When your body becomes your battlefield, the power of self advocacy in autoimmune disease. The first time I sat down with Paula Walton, I knew I was in the presence of someone extraordinary, not just because of her impressive credentials or her commanding knowledge of autoimmune diseases, but because of the quiet revolution she's been leading for over 2 decades. Paula has transformed the landscape of healthcare for thousands of Black women living with autoimmune conditions, women who were previously invisible to a system that wasn't designed with them in mind. Her work hasn't just saved lives, it's restored dignity, agency, and hope to an entire community that medicine has historically failed. As she told me with characteristic wisdom, the system wasn't built for us, but that doesn't mean we can't rebuild it. Have you ever felt like your body was waging a war against itself? That invisible battle happening beneath your skin while the world expects you to keep showing up as if nothing is happening? For millions of Americans living with autoimmune diseases, this isn't hypothetical, it's everyday life. And for Black women specifically, it's often a battle fought on multiple fronts: against the disease itself, against a healthcare system that frequently dismisses their pain, and against societal expectations to remain strong despite it all. Three words: I need help. For many high achieving Black women, these might be the three hardest words to say. We've been conditioned to power through, to be the rock for everyone else. The superwoman cape becomes so heavy, yet we wear it like it's part of our skin. But what happens when your immune system, the very thing designed to protect you, turns against you? When lupus or scleroderma or rheumatoid arthritis makes even getting out of bed an act of courage. That's when self advocacy becomes not just important, but essential for survival. Let me tell you about Shariah. After experiencing years of dismissive treatment from healthcare providers who underestimated her symptoms, Shariah, a Black woman living with lupus, reached her breaking point. Doctors would look at her, young, professional, put together, and assume she was exaggerating her pain. It can't be that bad, they'd say. Or worse, maybe it's just stress. But Shariah knew her body. After multiple misdiagnoses in her early 20s, she began meticulously documenting every symptom flare up, every joint pain, every rash, every day of overwhelming fatigue. Her persistence eventually led doctors to finally recognize the seriousness of her condition. I had to become my own medical researcher, she shared with Paula. I had to learn to speak their language before they would hear mine. This is the reality for too many. The burden of proof falls on the patient, especially when that patient is a Black woman. Research shows that Black patients are 22% less likely than white patients to receive pain medication. 22%. Let that sink in for a moment. When Paula shared this statistic with me, I felt a heaviness in my chest. Not surprised, because those who've lived it know this truth intimately, but the weight of the confirmation. The data simply validates what many have experienced firsthand. But here's where the story shifts. By joining patient advocacy groups focused on lupus awareness among women of color, Shariah gained knowledge about her rights as a patient. She learned effective strategies for communicating with providers. She discovered the power of bringing an advocate to appointments. She found her voice. Today, Shariah speaks at national conferences on health equity in lupus care. She's helped create peer support networks that empower other Black women facing similar challenges. Her work has contributed directly to improved awareness among clinicians about the unique presentation of autoimmune disease symptoms in Black patients. One voice became many, one story became a movement. This is what Paula Walton emphasized repeatedly in our conversations. Self advocacy isn't selfish, it's necessary. And sometimes self advocacy means community advocacy. Which brings me to another powerful example Paula shared with me. A group of professionals diagnosed with various autoimmune skin disorders formed an online support network specifically for patients from underrepresented backgrounds. These individuals reported feeling isolated after diagnosis due to stigma around visible skin conditions. They struggled to find specialists familiar with treating darker skin tones. The isolation was crushing. The medical gaslighting was demoralizing. But together they found strength. The group facilitated virtual meetups where members shared experiences navigating both medical systems and workplace discrimination while managing their conditions. Participants reported increased confidence advocating during appointments. Several successfully pushed their employers for reasonable accommodations at work, like flexible schedules during flare ups. This initiative grew out of frustration over limited representation within mainstream patient organizations. The founders wanted safe space tailored specifically toward communities historically left out of research conversations. Their impact? The network created educational toolkits now used by dermatologists nationwide. Their stories have been featured by major health publications as models for inclusive, peer led advocacy efforts. Their collective voice inspired new research into how social determinants influence outcomes among people living with autoimmune skin diseases across diverse populations. As Paula told me, when we share our stories, we're not just healing ourselves, we're creating blueprints for others to follow. But individual and community advocacy can only go so far without systemic change. That's where organizations like the Autoimmune Association come in, leading national campaigns aimed at improving policy frameworks affecting those diagnosed with rare or misunderstood immune disorders, including many affecting African Americans disproportionately. Patients often struggle against insurance denials or lack coverage altogether because certain therapies are considered experimental despite clear clinical need. This becomes especially problematic when compounded by racial bias or lack of provider diversity. Through coordinated letter writing campaigns and legislative lobbying days organized by advocates, including prominent leaders from historically marginalized communities, the association secured expanded insurance coverage mandates at the state level. The result? More patients now have access to life saving treatments without excessive delays or financial hardship. Years before these wins were possible, affected families would travel hundreds of miles just hoping someone would listen. They documented each roadblock encountered until enough data existed showing urgent need. Key milestones include passage of bills requiring insurers cover diagnostic testing costs up front, a move celebrated widely across social media platforms serving minority health advocates. These policy changes set precedent nationwide, inspiring similar reforms elsewhere while highlighting the importance of not just individual but collective self advocacy within the autoimmunity space. As Paula emphasized, policy change doesn't happen overnight, but neither does healing. Both require persistence. So, where does this leave us? What can we learn from these stories that might transform our own journeys, whether we're personally affected by autoimmune disease or supporting someone who is? First, self advocacy is a skill that can be learned. It starts with believing your own experience. Trust your body, document your symptoms, research your condition, prepare for appointments with questions written down. Bring someone with you if possible. And if a provider dismisses your concerns, seek a second opinion. As Paula wisely noted, you wouldn't accept poor service at a restaurant without speaking up. Why accept it with something as important as your health? Second, community is medicine. Find your people, whether online or in person. Support groups specific to your condition can provide not only emotional support, but practical advice for navigating complex healthcare systems. They can recommend knowledgeable providers. They can validate your experience when the world makes you question your own reality. And third, your story matters. When shared strategically, your experience can create ripples that become waves of change. Consider connecting with advocacy organizations working toward health equity. Your voice, even anonymously, can influence research priorities, healthcare policies, and public awareness. As Paula Walton reminded me, in the context of autoimmune disease, softness isn't weakness, it's wisdom. It's knowing when to rest, when to ask for help, and when to fight. For Black women, especially, who have carried so much for so long, embracing vulnerability might mean letting go of the superwoman cape. It might mean saying no to expectations that drain your limited energy. It might mean prioritizing rest without apology. Because here's the truth, you cannot pour from an empty cup. And when your body is fighting itself, you need every drop of energy for your healing. I want to leave you today with a challenge, a call to action that extends beyond this room. Whether you're living with an autoimmune condition or know someone who is, I challenge you to become part of this revolution of care. For those battling these invisible diseases, your pain is real, your experience is valid, your voice matters. Start documenting your symptoms today. Join a support group tomorrow. Speak up at your next appointment. Your advocacy isn't just for you, it's for everyone who will come after you. For healthcare providers, listen differently, see differently, recognize that pain presents differently across cultures and communities. Challenge your biases, expand your knowledge. Be the doctor who finally hears what others have dismissed. For policymakers, the gaps in our healthcare system aren't accidents, they're design flaws that can be fixed. Fund research that includes diverse populations, support legislation that expands access to specialized care. Make health equity more than a buzzword. And for everyone else, believe people when they tell you they're suffering. Hold space for their struggle. Amplify their voices when they're too exhausted to speak. Because ultimately, this isn't just about autoimmune disease. It's about recognizing our shared humanity. It's about creating a world where no one has to fight to be seen, heard, or healed. As Paula Walton said in our final conversation, the most revolutionary act is to insist on your own wholeness in a world that profits from your fragmentation. Your body may be a battlefield, but you are not alone in the fight. Thank you